there's a there's an article out there that's just awful, but you can read this where someone it's called Talking with Your White Clients About Race.
Mm.
It's open access, but the person who wrote this essentially takes you through step by step how to manipulate your patients into adopting progressive views on race, and how to justify incorporating this process into their treatment goals. So for those who are not true believers and who are aware of what's going on and who are aware of the vulnerability of counseling patients, this is a travesty of responsibility. And so the Society for the Ethical Practice of Psychotherapy, I co-created this organization as a patient advocacy organization. And we essentially do two things. We're there to provide fellowship for people who don't want to toe the line and who are concerned about patients who might be subject to indoctrination by critical social justice therapists. We're also there to provide continuing education options for therapists who are forced to include critical social justice to get their license. So, for example, Vermont just passed a law that in order to get and maintain your license, you have to have 1 credit hour or 1 credit of continuing education in anti-oppression and cultural humility,
Mm.
which, boy, those sound great, don't they? But when you look beneath the surface, you find that cultural humility means setting aside your individuality and accepting uncritically someone else's reality. It's essentially introjection. Now,
Mm.
we want to replace your beliefs with our beliefs, and if you don't do that, you're not humble or you're not a good person.